Good day, viewers. Dynamic Techno Medicals, the innovators in the field of orthopedic and surgical products, presents a brief video explaining the measurement and application technique of Comprezon Medical Compression Stockings. As per the American Venous Forum, graded elastic and compression hosiery is fundamental to the treatment of venous disorder. Compression therapy advocates the usage of medical compression stockings to compress the superficial veins, keeping their diameter small, force more blood into the deep vein system, accelerate venous backflow. As suggested by the American Venous Forum, the prerequisites of compression therapy are accurate compression, graduated compression, durable compression. Accurate compression. Conventionally, the pressure of compression stockings is measured in terms of millimeters of mercury. Compression stockings are classified based on the pressure they exert at the ankle. Class 1 is prescribed for mild varicosis without significant edema and early varicosis in pregnancy. Class 2 is prescribed for moderate edema, post-sclerotherapy and pronounced varicosis in pregnancy. Class 3 is prescribed for serious venous problems like chronic venous insufficiency and indurations of the skin. Additionally, varicose vein stockings are classified on the basis of the length into different styles AD, AF and AG. Typically, below-knee stockings AD are prescribed for perforator vein incompetence. Mid-thigh stockings AF are prescribed for varicose vein prophylaxis. Up to groin stockings AG are prescribed for post-surgery or venous stripping. Graduated compression. For any fluid to flow upward against gravity, a pressure gradient is required. Comprezon Medical Compression Stockings provide such a pressure gradient by applying maximum compression at ankle, moderate compression at calf, and minimum at thigh region. Durable compression. Comprezon ensures that correct amount pressure is given even after prolonged use and multiple washes to ensure the desired result. Presenting the size selection method of Comprezon Medical Compression Stockings from Dynamic Techno Medicals. Hope you have informative time. Selection of right size of stockings is important in the treatment of venous problems. For choosing the appropriate size, we should take length measurement and circumference measurement. For the size selection of AD, below-knee stockings take the length measurement from point A, the heel, to point D, which is 2 centimeters below the knee joint. If the length falls between 37 to 42 centimeters, the ready-made stockings can be prescribed for the patient. Take the circumference measurements at ankle B and widest portion of calf C. Then match with the given circumference measurement table to decide the size. For size selection of AF, the mid-thigh stockings take the length measurement from heel to the point 14 centimeters above knee joint. Check whether this length falls in 55 to 70 centimeters interval to ensure then ready-made stockings is suitable. Take the circumference measurements at ankle and widest portion of calf and match with the circumference measurements table to decide the size. For size selection of AG, the up to groin stockings take length measurement from heel to the point at 4 centimeters below the inguinal fold and check whether it falls in 70 to 80 centimeters interval to ensure the suitability of ready-made stockings. Take the circumference measurements at B, the ankle, C widest portion of calf and G 4 centimeters below inguinal fold and match the appropriate size in circumference measurement chart. Presenting the application technique of Comprezon, the medical compression stockings from Dynamic Techno Medicals. Proper application of medical compression stockings is an important part in compression therapy. Following these steps will ensure desired result. Sit down in a comfortable position with your legs raised. It is better to wear gloves before application. Note that toenails must be trimmed and heel cracks must be smoothened. Apply talcum powder to keep the hands and leg dry. Turn the stockings inside out. Fold the foot portion up to the heel pocket. Wear the foot portion of the stockings up to heel. Pull the remaining reverse portion up the leg. Never overpull the stockings, which will result in bunching at the top. Smoothen out the wrinkles with a gentle upward motion of the hands. While removing the stockings, sit down in a chair comfortably with legs raised. Fold the silicone top band. Hold at the top of the stockings. Pull down the stockings with a smooth downward motion up to the ankle and gently ease out the heel from the heel pocket. During the usage of medical compression stockings, if the patient experiences excruciating pain, discontinue use and consult a physician. Do not fold the stockings at the top or bottom. Remember, incorrect way of application will not give you expected results. Take care of the following points while using the stockings. Rings, bracelets and other jewelry should be removed before applying to avoid damage to the stockings. Use gloves before application. Fingernails and toenails must be trimmed and heel cracks should be smoothened. Make hand and leg dry before application. Do not use defective shoes or sandals along with stockings. Wear socks over the stockings if you are wearing sandals to prevent tearing of the stockings. Hand wash only. Do not hang to dry. Dry on a flat surface.